Madam Chairperson, on behalf of my party, Indian National Congress, I stand to share a few thoughts on the demand for grants presented for health and family welfare. Thank you very much for giving me the time. Madam, we are passing through unprecedented times. The global COVID pandemic has brought the world economy to a grinding halt, and countries, including India, are in the throes of a severe recession. We are truly caught between the cliff and the sea as we strike to balance lives with livelihood. The COVID pandemic has actually shown us that despite the progress, how vulnerable we are when it comes to fight against nature. I must note that the nation has stood with the union government and all the state governments, irrespective of their political affiliation, have abided by the advice of the central government in containing the pandemic and now in the rollout of the vaccine. Let me share a few observations on the proposed budgetary allocations for 2021-22. The budget for 2021-22 has apparently an enhanced allocation of 137% increase for health and well-being. But it is largely on account of subsuming allocation of the other sectors like water and sanitation under the broader health sector. The allocation proposed in budget estimate for health and family planning, health and family welfare 21-22 is 71,289 crore. While this is 9% higher over the current year's budget estimate, I must point out that it is actually 9.6 lower than the revised estimate of the current year, which stands at 78,866 crores. Similarly, the 4% increase proposed in the outlay for the National Health Mission is grossly inadequate. Coverage of families under Ayushman Bharat also need to be increased from the present 10 crore families to reduce out-of-pocket expenses for the large numbers of poor and lower income groups who may not be covered as per socio-economic caste consensus data, but can be considered hardly well off to afford expensive health care. I may add that in Punjab, where a total of 60 lakh families, only 14 lakh families are covered under Ayushman Bharat. We from Punjab have covered another 26 lakh families under the state-sponsored insurance scheme called Sarbat Sehat Bima Yojana, as at par with the Ayushman Bharat. It needs little saying that our health infrastructure is woefully inadequate to handle the kind of pressure we have witnessed in the last year. Our secondary facilities, civil hospitals, subdivisional hospitals, obviously could not cope with the treatment requirements of the COVID patients, putting a huge pressure on the scarce tertiary care facilities in government medical colleges and super specialty hospitals. Even though there has been a massive ramping up of facilities, much more needs to be done. And here, like my colleagues, I would like to mention that the pay of the ASHA workers should be enhanced. Madam, where I am talking about what is lacking in the budget for enhancing our health care, there are a few suggestions that I would like you to consider through you, the Health Minister. First, to augment our primary healthcare facilities so that preventive healthcare can improve. Secondly, curative facilities in secondary and tertiary care hospitals in government sector must be improved through a special mission mode project over the next 1 to 2 years. The center and the states can jointly share the fund allocation. Thirdly, I would like to urge the House that let not this important issue be drowned in the labyrinth of the numbers that they are saying 137% increase in allocation. What we should be concerned are the outcomes we seek and the funds required to meet them. I therefore urge the House that take what it may, and I mean it, take what it might, that we must collectively provide for it, even if it means tightening our belt elsewhere. The centre must lead and the states may follow.
माननीय सांसद
Sir, there's just,
जयदेव
Madam,
गल्ला
there are
जी,
just two things I would like to just put forward, two requests that my state of Punjab has made. One is the sanctioning of 200 crores for effective COVID management. I request the ministry to release these funds forthwith, as now we are in the second surge of the COVID in Punjab. And I would also like them to review the current vaccination strategy to include vulnerable groups such as school and college teachers, drivers, journalists, judicial magistrates, workers in markets, and include those groups, age groups, which can spread the disease but are less vulnerable to illnesses. And lastly, Madam, I would like to also ask for a genome sequencing lab so that we can also be, there's nothing in the north of India, and the sanctioning of a medical college in Gurdaspur, which is a border district.
टाइम आपका जाएगा.